here quickly. So when the guys join, it'll just be quiet, and we could just, I'm just going to unmute you quickly. Just give me 1 second. All right, Jameel, can you hear me? Can you just say something?
Yeah, I can. Yes, I can.
Okay, cool. Right, we're going to start then quickly. I'd like to introduce Jameel. The guys that don't know Jameel, he's a dentist from Scotland. He's originally South African born. You won't say that with the accent, but his parents are South African. I met him through the digital smile design stuff. He's a digital instructor under Christian Coachman. He's also a Slow Dentistry Network guy, and I think that's why we need to speak to him. And he's one of the guys that's really cutting edge in dentistry, and I've been following his stuff on Instagram, and I've been trying to get to speak to him for a long time, and now with this COVID-19, I think it's a good time to catch up with you. Just to give you a bit of background, I'm sure you know what's going on in South Africa. We've been placed under lockdown from tomorrow evening, and we've got very little information on how we're supposed to work as dentists. SARA didn't really give us clear instructions and clear information. And the information from government is that we're allowed to be open. But I think it's confusing a lot of people, and a lot of practices are going on like normal, and they're not changing anything. I heard one of the big group practices there, the message they got was that they're open for business as normal. So what I want you to just tell us, what are you guys doing in Scotland, and what do you think we should be doing in South Africa? How should we change our approach to patients? Should we be open? Should we close and just see emergencies? And if we see patients, what precautions should we be taking when seeing those patients? So if you can just maybe elaborate a little bit, and then we're gonna give everyone some time to ask questions. So on the app, there's a place where you can put your hand up. So if you've got a question towards the end, I'm gonna say when we can ask questions for Jameel. And then we can open it up to a discussion, and then just talk about what we think and what we're going to do. And also, if we can share this message, I think a lot of guys are kind of not taking this thing seriously enough. So yeah, Jameel, thanks for joining us, and tell us about your practice and what you guys are doing.
Yeah, great. Thank you very much. So first of all, hi everyone. It's really a pleasure to join you this evening or this afternoon here in Scotland. And thanks to Everett as well. I've got a lot of time for Everett. It seems that you're not really working most of the time, right? You're always on Jeffreys Bay, either swimming or kite surfing or something like that. So this lockdown is going to be easy for you because you're just going to do the same things that you did before, right? So yeah, it's a very strange and crazy time in the world right now, isn't it? And I think you started off by saying that you know, you guys have gone into lockdown, and you know, in many respects, that's really far ahead of many places in the world. So I think South Africa should really be congratulated for that. I mean, we only went into lockdown or a proposed lockdown about 2-3 days ago, and it's definitely not the same as you guys have. I mean, I'm getting all the messages from my South African dental friends and family that's in SA, and the regulations that you've got to follow, and the armies on the streets, and the things that you need to have with you, or you will need to have with you to go out to get you know, groceries from the supermarket. You know, that's really far ahead of lots of countries in the world. But I really do think that it's appropriate for the time that we're living in, and I wish that many other countries, including our own, took this as seriously, it seems, as South Africa is doing it. I know obviously you guys have a problem in South Africa, in sub-Saharan Africa, with the amount of immunocompromised people you have. So it has the potential to get really serious over there. And I think it looks as if the right things are being done. So I think South Africa really has to be congratulated for that. And hopefully, God willing, you know, we can come out of this the other side and go back to our lives as soon as possible. I think you also mentioned, Everett, that you didn't really get a lot of guidance from SADA. And that's pretty much similar to us here as well. I mean, the General Dental Council has put out really almost no guidance for us. It's been left up to the chief dental offices of the different countries, Scotland, England, Wales, Northern Ireland, to put up some guidelines. And these guidelines have come out in dribs and drabs. And in a lot of cases, doesn't really have a lot of scientific basis or strength behind it, but it's just what they think is necessary for this time that we're living in. So you're totally right in saying that, one thing that this time is showing us, where the world's been shut down, we really been shown who's got our back. And unfortunately, it's really not been the government, and especially in our country. It's not been the bodies that are supposed to be regulating us and giving us the guidelines to follow. And it's really disheartening in these respects. And I mean, even, I don't know about you guys, when, the things like the banks, who you would think would be a little bit more sympathetic, they've put up the overdraft rates from like 9% up to about 40% during this time. So it looks like everybody's in it for themselves. And I think what we as UK dentists and Scottish dentists are finding out, that we've really been left to ourselves to try and come up with something that's going to be workable now, and workable, I think, sometime in the future as well. So there's not a lot of guidance out there. But one thing that I'm really super happy about is the Slow Dentistry Global Network that you mentioned, Everett. And for those of you that don't know, Slow Dentistry is really the brainchild of Miguel Stanley, also a South African. He was born in South Africa. He stays out in Portugal. He's probably one of the most famous dentists in the world at the moment, and a guy that I've got really a lot of time for. He's really a visionary. He really has patience and the profession as his number one goal. He's not out to make a fast buck or anything like that. And he's really trying to do his best, use his position that he's in, for the betterment of the profession and definitely the betterment of the patient. So slow dentistry is something I think you guys are going to hear a lot more of, especially because of this. And, we had the Slow Dentistry first conference in London in November last year. And it was really well attended, sponsored by Voco, right in the heart of London. I got a lot of good press. But again, it's one of these things that, it's not super sexy, right? Because it's not like clinical dentistry that we're talking about. It's really about patient management. It's really about making sure that your practices are clean and sterile. It's about doing dentistry in the right way. It's about trying to follow gold standard protocols. It's the things that we all do behind the scenes, but we don't get paid for. And, for that reason, I think a lot of people take it lightly. So, planning cases properly, utilizing things like DSD, digital smile design, to make things more accurate, predictable, efficient, taking care of our patients, making sure we're doing the consent process properly, making sure we're giving the anesthesia and waiting for the correct amount of time. So there's loads of that, there's four main cornerstones for the slow dentistry to become a slow dentistry practice. We probably all do them to varying degrees. But I think it's going to be something that you will hear a lot of very quickly. And what we've been doing over the last week, some of the Slow Dentistry Global Ambassadors, is trying to put through some guidelines that dentists can follow in this time of this worrying time with this virus all about. And it's yet to be released. So you guys are going to be kind of the first ones to hear the different protocols. It may change slightly. But hopefully by the end of this week, beginning of the following week, it will be released. So a lot of these things are coming from people in our network that have lived through H1N1, that have lived through SARS, where not SARS from your guys' point of view, right? The income tax guys, but the SARS, the bird flu, and the respiratory issues from the virus. People like Ronnie Yap, based out in Hong Kong. People like Huang, based out in Beijing in China. So they've been through it, and they've had to adapt their clinics to be able to run in a safe, predictable, and efficient manner. So without too much more ado, I think what we'll do is we'll just go through each of the points, and it's about 10 points or so. And if you want ever, just feel free to button and ask questions, because it's actually good that this is like a bit of a sounding board.
Yeah.
That what do people understand? What things should be included in these things going forward?
I should unmute everyone so everyone can ask a question if they feel like it?
Look, it's up to them. They're more than welcome. I think what you can do is you can unmute if you're new to Zoom. What you can do is you can unmute it, but then the individual can go to their little picture. If you hover over it, you'll get a little icon there, and you can mute your own mic. So that means when you want to speak, just unmute it yourself. So you can mute everyone's if you'd like, Everett. And then when you want to speak, just unmute it, and that way we don't get any background noise. So number one, and again, these are in no particular order, but number one, it goes without saying that we have to regularly clean the practice. You know, the floors and the surfaces of the non-clinical areas and the clinical areas should be scrubbed and cleaned on a daily basis, and with proper detergent, with proper cleaning fluids. And it's not just the clinical surfaces that we will clean. It's not just the floors, but especially now, this is something that we were doing 2 or 3 weeks before it hit us here in the UK. But all the places that patients would touch, so the door handles, the handles of the door inside and outside, this is being cleaned not just once or twice per day, but regularly throughout the day. Okay, so super important that our reception staff in our clinic, every 30 minutes or so, we'll be taking the wipes and wiping the reception desk down. We'll be going out and wiping the seats down. We'll be going out and wiping the handles of the doors down from the outside coming into the surgery and each of the individual surgeries themselves. So that goes without saying. We want to have practices. We want to have disinfected environments, and it's very important to have somebody in the
just give us a second. Sorry, Jameel. Sorry, I are you there? Sorry,
yeah, can you hear me?
Okay, just go ahead. Sorry.
It's no problem. It's no problem. So what I was saying was that we want to have somebody, if preferable, allocated to do this. So it's maybe one member of the reception team, obviously each nurse in the surgery, but somebody that's taking responsibility for the cleaning of the practice, the actual superficial floors, clinical areas, door handles, these type of things. Okay. And you were saying so number two. So this is what we were doing in our clinic every so often. So every 30 minutes or so, because we have some patients coming through regularly, touching the reception desk. And the problem with this virus is that you don't know who's an asymptomatic spreader. And that's the real thing, because it's got such a long incubation period, 14, can appear anywhere within 14 days, usually around about 7 days. You could have people that don't exhibit any symptoms, but they're spreading the disease. It's on their hands. They're touching the reception desk. They're touching the handles. And then this is a big way that the virus can spread. So on a regular basis, doesn't have to be every half an hour or so, just half an hour that we put into our clinics, okay. But somebody should be trying to clean these areas, okay? Number two, all staff should regularly be cleaning their hands for at least 20 seconds, preferably with soap and water, occasionally with the hand sanitizer, but it's better with soap and water, we know that. There's a lot of great videos going on on Instagram and Twitter about the best way to wash your hands, the surgical ways. As dentists, we should know this anyway, but perhaps our staff members don't, maybe our reception team don't, maybe the nurses don't, if they don't assist us when we're placing implants or doing surgical procedures. So there's lots of really nice 20, 30-second videos showing you the best ways of cleaning your hands. And what we're asking and in this point is that we should be able to do it, but we should also be able to train our staff and reinforce this on a regular basis, because it's not enough, just telling a person once to do it. We have to be able to remind them repetitively again and again. And Miguel actually put a note to say that we should really have posters on hand washing near every basin. So as a result of this, we can be reminded about it. The staff can be reminded about it. And this, is really primarily for our own safety, because we know that taking all the precautions at work, the greatest risk is not coming from us to the patient, but from the patient to us, right? All the people that we're seeing, we don't know, what's happening there, where they're coming from, what they have. Are they being truthful about what they're saying, where they visited, the temperature that they had, do they have any symptoms? We don't know this. So we really want to make sure that our staff remain healthy, and from that, our families remain healthy, because we'll be taking our clothes, we'll be taking our shoes into the houses where we live. And this can be a big problem if we have elderly parents that live with us, or people who are immunocompromised, asthmatics, these type of things in our houses as well. So it's super important that we make sure that we wash hands at least for 20 seconds, preferably with soap and water, and we can have the hand sanitizers as well. The next point is about, in every clinic, there should be really a clean zone. Now, this is something new that we hadn't really discussed with Slow Dentistry, but I think Miguel has it in his clinic in Lisbon. And I think it's really important that we all try and think about this, that there's a clean zone where only dental and medical personnel can go. Okay, so in everybody's clinic, this is going to be different. So if you've got a small clinic, maybe you've got to have as the dirty zone the reception, but as soon as you step into the clinics, the actual surgeries, that's where you start into the clean zone. Or if the clinic is big enough, then you have a particular area which is designated from here on in is the clean zone. And what would mean by then is that in the clean zone, only people with properly disinfected clothes, disinfected shoes, the shoe coverings as well, if the patients are coming in, the plastic wraps that they put over their feet, these things, as disposable ones that you can take it on and off, should be happening. So really important to limit the people that are going into these zones. And obviously the patients need to come in, but as the patients come in, they need to put on these shoes, make sure they've used the hand sanitizers that we'll come to in another point, that we should really have at the reception desk, at the entrance to the operatory, in the surgery as well, so that we, not only are we washing our hands, but the patients are coming from outside, they're washing their hands. So typically in our clinic, just over the last 3 weeks, the patients would enter the door to the clinic. There would be a hand sanitizer there. They would wipe their hands with the hand sanitizer. They would sit down. They would come into the surgery for their dental work. We have hand sanitizer again that they would utilize before they go to the reception desk. At the reception desk, we were not taking any paper money anymore, but we were just using contactless methods. So until we don't find out exactly where the virus is staying, where it's not, it's better to be safe than sorry. So back to this clean zone, really important that we have clean zones designated. And again, a lot of these things are going to think, is this overkill? Is this something that we're going overboard with? But I really think that this is best practice that we really have to try and get in the habit of using. And we've been really shaken up by this virus, because if our practices in the world can be shut down by this, it's really important that we have systems and protocols in place that allows us to do these things, to practice our jobs in a safe way for ourselves, our staff, our patients, and our families in the house. So coming back to the clothes that we wear, I think a lot of us sometimes come in to the office sometimes in scrubs, sometimes in uniforms already. Maybe our staff come in like that. I think what we're asking our patients to do, or what we're asking our staff to do, especially in our clinic, is to come in with their normal clothes and then to get changed into their clinical wear in the clean zone. So the scrubs are disinfected, the scrubs are clean, and then you'll get changed into that. You'll change your shoes. So we're not taking the same shoes that you should have one pair of shoes for your clinic, and you'd wear them there, and you wouldn't wear them outside, because we don't want to take what's inside out, and definitely we don't want to bring what's outside in. So to try and keep it as clean as possible, really super important to think about the clothes, think about the fact that we should be taking the tunics off, the scrub tops off, leaving it at the clinic, washing them at the clinic. Now, obviously, this is going to take much more time. This is going to be something that is going to be a little bit more labor intensive, but it's all things that we have to be starting to think about. And it's not going to happen overnight, but it's things that we have to start getting in the mind of, that how can we make things much more clean, much more sterile, so that, again, you know, it's safety first for ourselves, our families, and our staff. Another important thing to mention, just while we're at the clean zones and the dirty zones, is that I don't know how much you guys get with deliveries coming into the clinic. You know, whether that's equipment, whether that's Amazon packages, whether it's letters, boxes, etc., consumables being arrived on a daily basis. So number one thing that we noticed is, before we would have to sign a pad, or we'd have to sign documents that the FedEx people would bring in. Now they've stopped that as well, right? So you don't have to sign anything. They just mark it down that you've signed it on their behalf. So we don't want to be touching the pens. We don't want to be using their pens and signing on the paper and holding the paper for them, okay? And as well, the packages that we're taking in, before they're being brought into the clean zone, they are being wiped, right? They've been disinfected with a wipe from somebody with gloves at the reception desk, because all of these are potential sources of bringing the virus or whatever pathogen it is into our clinics. So really important to think about that. You know, all these potential places where the pathogen can come into our clinics. Now, the next part is the thing that was really written down on the if you've been to the Slow Dentistry Global Network website, was the proper disinfection of the surgery itself, or the clinic itself. Now, we know that we use alcohol wipes, we use different types of disinfectants to be able to, wipe down the chairs. But the problem is that we're wiping down the chairs, but we're not letting the disinfectant work for the appropriate amount of time. So the studies showed that you need at least 8 minutes, preferably 10 and longer, for the material to work. So in a clinic that has a high volume of patients coming in every 10 minutes, every 15 minutes, every 20 minutes, every half an hour, that's not really something that people can do adequately. It's not going to work. It's just like superficially wiping it down. You might as well just be wiping it down with detergent, right? And then getting the next person in, because it's not really killing any of those pathogens or doing any of the work. So what Slow Dentistry is really going to specify is that you have to have this time built in between 10 to 15 minutes between patients. Now, you can see as many patients as you want. A Slow Dentistry clinic can see as many patients as they want throughout the day, but you have to build between patients at least a 10-minute buffer or 15-minute buffer for the material to work. Now, Miguel out in Lisbon, he only sees patients for an hour, right? So every patient is booked in for an hour, sometimes longer, but the minimum time that you can be booked in with him is for 1 hour. And even if you're coming in for suture removal, you will be given 1 hour, right? So that's just the way that his business operates. That's the way that he wants to work. And as a result of this, he's got plenty of time to be able to sterilize and disinfect the clinic. Now, practically for other dental clinics like myself, we're not going to be seeing just one person in 1 hour, right? So if we're going to see a patient for 10 minutes for suture removal, then we will build in, and we have been for the last year or so, building in that 10 minutes extra to be able to wipe this chair down, to make sure that we give it enough time for the disinfectant to work. So this is one of the main cornerstones of Slow Dentistry, or was one of the main cornerstones of Slow Dentistry. But it's kind of being expanded on, and I think the one that we have to think about doing, and I think our patients will appreciate this. Our patients will respect us for this. The patients, look, the world's going to change, right? As soon as this time's over, the world's going to change. People are going to be more aware of health. People are going to be more aware of cleanliness. People are going to be more aware of those people who are really out to look after the patients. They're not out for a fast buck. They're not out there to take advantage of them. So it's really important that the clinics of the future, the ones that are going to be successful out of this, are the ones that are going to be really have the best of patients' interests at heart. So when we build these things in, then automatically we will get known that we are the cleanest practice in the whole area, and from that we will be making up any potential shortfall that it could be, because we're not seeing as many patients as maybe our neighbor down the road. The next point to mention is that receptionists should avoid shaking hands. The dentist should avoid shaking hands with people, our patients that are coming in. So, you know, you've seen some of the video that's going online of Trump when this whole COVID thing was getting more and more popular in the US, and he's doing the interview or the press conference from the Rose Garden, and he's shaking everybody's hand, right, and he's touching his face, etc. And he's saying that don't do these things, but he's doing them himself. And similarly, you know, we had a really funny video of Prince Charles going. I guess he was coming to the theater, right, and he was trying to shake people's hands, and people didn't want to shake his hands and things. And now today we find out that he's got COVID, right? So he's been affected as well. So it's really important that our receptionists don't shake hands with the staff, and we don't shake hands, but we move to another type of greeting, you know, whether that's the namaste one or whatever it is that we choose, or the elbow bump or whatever it is. I think this is going to become de rigueur as time goes on. And in some cultures as well, I'm not sure if it's like that in South Africa, it's definitely not here, but sometimes there's a kiss on the cheek that you would give the staff members, or you'd give the patient a kiss on the cheek, more for a European thing, I think. Yeah. But it's going to be written into the slow dentistry protocols that we're going to avoid this, and definitely no kissing on the cheek between staff members as well. So,
also the lips.
You know, it's really important that we... Yeah. Yeah, that's right, on the lip. Well, anywhere ever, right? Okay. So try and avoid it. And so then the next things we come to, and I'm mindful of the time, so I'm going through it a little bit quickly, is that we want to make sure that we use appropriate antimicrobials before we start treating the patient, right? So, you know, when we do implants, we'll give them chlorhexidine to be able to use for like a minute beforehand before we place them. So I think for all procedures now, you know, we will be using antimicrobials, and specifically for the virus, we've been finding that 1% peroxide is very good for it. So the peroxide comes from Colgate. It's made here in the UK by Colgate. The peroxyl has 1% hydrogen peroxide mouthwash. So we'll get our patients to rinse and gargle with this before we actually treat them as well. Okay, so that's really important. And the next thing then, coming to then the treatment itself, well, from what you mentioned at the front, that, you know, at the start of this meeting, that you've been advised, or some clinics are going and still treating patients. This is absolutely not the right thing to be doing. If you have any consideration for the safety of humanity, the safety of South Africa, the safety of your place, the safety of your staff, yourself, your hygienists, your family, now is not the time to be working. And especially the thing that's caused the most confusion over here is with aerosol generating procedures, which is, or we're calling them AGPs now, aerosol generating procedures, because we went through sort of like a system of slowing down before we actually got to not seeing any patients. So before, okay, you can see everyone. The next thing was, well, you can see everybody except aerosol generating procedures. Then, okay, no, you have to cut things out and only see emergencies. Now we're not even seeing emergencies, right? So now it's only antimicrobials, analgesia, and advice. These three things, the 3 A's. And then if a patient needs treatment, we are directing them beyond this. We're directing them to particular hubs where dentists will have the full PPE equipment, etc., the gloves, the masks, the visors, etc., because we know there's a shortage of them all around the world at the moment. So definitely at this particular point, until we get more research, no aerosol generating procedures. And if for some reason you still have to, better try to do it under rubber dam. Although there's some studies that are showing, unfortunately now, just to put the fly in the ointment, that sometimes you'll get a little bit more of an aerosol generated with rubber dam, but at least it's not going to be coming from the patient's saliva. And that's why it's really important that we have high volume aspiration. So the days of maybe the dentist working by himself or just using the saliva ejector, right? I think those days are gone. I think you really have to have somebody dedicated with the high volume aspirator to be able to, at the point of where we're doing the drilling, to be able to suck up as much of that aerosol as we can. And then, obviously the next part comes to the fact that, well, what protective equipment are we wearing whilst we're doing these procedures? So I definitely think goggles and visor is mandatory. And the masks are mandatory together with a gown. Now, there's a lot of debate about the masks and what type of masks we should have. I think that the general feeling is that the masks that we have right now are not suitable. I did see, because some clinics didn't have the the FPP2 ones or the 3 ones, that they were using the masks that we have, but they were double masking. Okay, so double masking is something that you can do if you don't have the proper mask right now. But definitely the FFP2 and the FFP3, Everett, for you and I, we're going to have a problem with the FFP3 because you really need to be clean shaven, right? So to be able to fit properly. So are you going to have to getting all the dentists to shave their beards or whatever? I was actually looking last night and Googling, well, if you do have a beard, can you get fitted for FFP3? And apparently the only thing that it's going to work for us is going to be those like fireman's masks, those big gas masks that you're going to be putting on. Okay. So I'm preparing myself to actually get one of those and buy one of those when it starts. So there is things for people with facial hair, like yourself, to be able to use. But if you're going to be using the FFP3, you have to be clean shaven to enable it to be effective and to work. And then obviously we want to make sure that we're using rubber dam in general. It's one of the points of slow dentistry anyway. One of the cornerstones is that we're using rubber dam at least for every single RCT procedure, if not more. So that's at a minimum. And obviously that will decrease the bacterial load and the bacteria that we're coming into and that we're aerosolizing into the atmosphere. And coming towards the end of the points is that all rooms will really be aired regularly, because we're finding that when we do the aerosol generating procedures, that the aerosols are staying in the atmosphere for at least 2 to 3 hours sometimes. So we're going to have a way where we air the rooms out so that we remove as much of the pathogens as we can. And I think it's going to be a case where we may start to go down using ozone cleansers or HEPA filters or plasma filters in every clinic to cleanse the air. Now, one issue with the HEPA filters is this, that the conventional HEPA filters, so they're portable. My son's got allergies, so we have a HEPA filter in his bedroom. It's carbon filter, removes the dust, the allergens from the air. It's really great. It really gives a really good, clean air to be able to breathe in. So there are ones that are there that you can buy, but the problem is that most of these HEPA filters only filter out 0.3 of a micron, up to a maximum 0.3 of a micron. And we know that the virus is about 0.17. So they're having to be updated to be able to take the virus out of the atmosphere as well. So I would presume in the next month or two, there'll be a whole host of companies coming out with air purifiers, specifically for us. I mean, they're used routinely in ICU and in hospitals anyway, like the plasma filtration. And one of our slow dentistry ambassadors, Bartosz from Poland, he put on the chat today that he's actually just bought one of them for the clinic. So I think rather than jumping out and buying those things right now, you just rather hang tight, wait for the new ones that will definitely be able to take the coronavirus out of the atmosphere. I know the plasma filtration one takes out influenza, but I'm not sure that it's going to be taking out coronavirus just yet. So other things, just by when I'm thinking about them, that what did we do? Well, sometimes we have magazines in the waiting room. So we've taken out the magazines from our waiting room. So we don't want anything that people can be touching and putting back and forth, that kind of thing. And, trying to minimize the amount of patients that come into our surgery. So before we were shut down, before all the clinics shut down, what we would do is we designated 3 zones or 3 areas in the clinic where patients could sit, and only one patient could sit in that place. So if we were going to be seeing, for example, we've got 3 clinics, 3 patients came in, they would be at the appropriate social distances from each other. Or alternatively, the better strategy was that we would tell the patient just to wait in the car. And then when the dentist was ready to see them, we would call them and they would come straight into the clinic. No chit chat at the door or at the reception, but straight into the clinic and then get to do the treatment. And the patients were very, very, very appreciative of this. So don't think that, oh, it's going to put the patients out and it's going to, it's going to be more of a hassle. No, the patients really do appreciate it. So these are just some things that sprung to mind when we said, okay, we change it from the podcast that we were going to do, just chatting about DST, but go on to this. And I think it's a great idea. This is a very worrying time for every one of us. It's a really worrying time to be a business owner right now, because not seeing any patients means no money coming through. Yeah. And, we all hope that we have businesses to go back. And I'm sure we will. This time is going to pass, right? But we might as well use it for ourselves to become better people, to put in place protocols and systems that maybe we didn't have, so that we become, we're safe, our staff are safe, our patients are safe, our families are safe. And I think it's these practices that are really the ones that are gonna thrive. Just before I came on here, I was in a web meeting with Christian Coachman and some of the DSD clinics. And he said something really nicely, that some people are just, during this time that they're off, whether it's a 2 weeks or 3 weeks of shutdown, they're going to just chill, right? But we don't want to do that. We want to make sure that during this time, we're getting better as people, we're getting better as dentists, we're getting better as, we're meditating, we're thinking about the reasons that these things get in touch with the earth again, with the environment again. And Brendan McDonald, who is one of the chief marketing officer for DSD, he said something really nice, that when the world was hitting pause, we were hitting play, right? So this is really what we want to do. We want to be proactive. We want to make our clinics better for our patients. So when we come back again, we're ready to go, safety-wise and clinically wise. So that's all really I have to share with you guys right now. I think if you have any questions, I'll be more than happy to talk to you about it or answer them.
Yeah, guys, so just, Jameel, thanks so much. When you've got a question, just unmute yourself and ask the question. While we're waiting for whoever wants to ask the first question, I just want to ask you, these things you mentioned now is things you're going to implement for the rest of when you open your clinics again, you'll implement all these things.
Yeah.
For example, the magazines.
Yeah, correct. So before, being a slow dentistry clinic just meant, well, from a sterilization or disinfection point of view, was just making sure that you would wipe down the chair for the appropriate amount of time, already assuming that you had really good cross-infection protocols already in place. I mean, in the UK, we get examined on that every 2 years or every 3 years. There's an external dentist that comes in, make sure that we've got the washer disinfector, make sure that we've got the autoclave working, make sure we're bagging specific instruments. So that's a given. But then to implement all these other things, but what this event has really shown us, this tragic event in the world has really shown us, is that we really have to up our game, and we have to try and detail all these things little bit by bit, maybe 10 steps or 12 steps or 15 steps that we have to follow, so that dentists all around the world can benefit from this.
Right, then your advice for us for the next few weeks is close the clinic completely, just treat patients with analgesics and antimicrobials, and refer them if we have to.
Correct. So, but again, all this depends on you guys as well, whether you have appropriate hubs to be able to treat the patients that you're going to be sending them there, right? So, last night, this is the first time that we were let known about this, is that we've got certain protocols that we will follow, like a telephone questionnaire. That, do you have pain? Is that pain being able to be controlled with analgesia? If not, okay, come back and see me in a week. If it's not being controlled with analgesia, then go to step 2. Then you'd ask them this particular question. Well, is it related? Is it keeping awake? And all the things that we usually ask them, but just basically being able to triage them so that we can only refer on to the hubs those patients that really need it, because we're going to expect that the health service is going to take a big hit here. And we want to try and keep out of accident emergency all those patients that we could treat, or the dentists in specific hubs could treat, to take pressure off the health service and let them see patients that are suffering with this, in ICU and in with respiratory problems.
And as a practical rule, your staff members, are they at home at this stage, or are they at the clinic, or what do you do with them?
Yeah. So right now we have to have the clinic where we did have to have the clinic running up until yesterday before we were told to go to just triaging them. So right now, because we just have to triage them specifically, we could get a mobile phone and we can get the telephone number for the practice directed to the mobile phone, and we could give advice over the phone, right? And if, at specific points in the day, we will meet the patients with some prescriptions, or we could phone the prescriptions into the pharmacy. They could pick it up. That would be even better. So we don't have to do that. But for the last week or so, we've just been down to a rota. Okay, so what we would do is we'd have two specific groups so that they are never meeting. So if one group goes down, then we have that other group to follow up on it. But we would maybe, do 2 days, one group, 3 days, another group, and vice versa, that kind of thing. So basically dividing them into teams. So
Okay.
right now we don't have a full complement of nurses working, but we have one or two.
Right, is there anyone else who wants to ask a question? Davy, I know you always have questions to ask. I'm going to unmute you, Solo. Davy, can you hear me well? Jameel, Davy is our. Can you hear me? Davy?
I can hear you.
Davy, can you hear me?
Yeah, okay, what do you might know?
Yes, Jameel, Davy is our version of Miguel Stanley in South Africa. So I want him to just pop in quickly and tell us what you think. He's as handsome as well.
Oh, thank you. No, I think you're exactly right, Jameel. Basically, I agree. We've got to go there. We have a problem with having a hub that to refer to. A serious problem with that. But in effect, what we've done is we've practically shut down. We've got 2 emergency teams that rotate, and we triage by phone, and only if it cannot be done, as you said, with your 3 A's, do we go in and manage. Right. I think other than that, we're risking ourselves, we're risking our clients, we're risking our staff. Not worth it.
It's not worth it, man. Absolutely. Life will go on after this, and we want to be part of that rather than being sick or be the cause of somebody else becoming sick.
Guys, just on a practical note, who keeps that phone? Are you guys keeping it by yourselves or one of the receptionists, or what do you do?
So right now we haven't moved on to that just yet because we still have staff in the surgery or in the clinic, as I told you, those teams that are going through. So last night they prepared, the chief dental officer prepared a script. I told you already, to triage the patients, but they also prepared a script for out of hours services. They want the same telephone message to be heard by every patient. When they phone, that we'll get back to you tomorrow. If it's really urgent and you exhibiting signs of COVID, then you will be directed to a specific area. So there's a difference. I forgot to say to that. There's a difference between hubs that will be for specific COVID patients and people who are no symptoms. So I'm talking about referring patients to the asymptomatic group, to the dentist who will man it, will have the masks, will have everything on. But the people who are exhibiting symptoms, they are only going to be going to the dental hospital here on floor 6, where they will be dealt with the full kit, everything, hazmat suits, everything.
Cool. Davy, practically, you guys, are you keeping the phone with you, or who's got that phone for patients to phone in?
No, we've got staff doing an initial triage, right, just to filter out that we don't become receptionists trying to tell people that the practice is closed. And then from there, if need be, they will refer the patient out to one of the dentists, depending on who's on duty, when it becomes a clinical call, rather than just we want to make an appointment, because we're still getting a lot of those. People seem to forget that there's actually a shutdown or a lockdown, strangely enough.
Guys, if I can come in here, it's Dit speaking. What we've done is we've shut our practice down completely. We have a telephone system which leaves a message for patients to SMS or WhatsApp our receptionist, who has the emergency phone at home. She will filter out the appropriate calls, and then obviously WhatsApp or SMSs, us as dentists. We two dentists, so what we've decided is that we're not going to expose our staff to any risk whatsoever. So we're going to be assisting one another. So if there is an emergency call that has to be done, one of us will be the clinician and one will be the assistant. I don't know how that sounds, but we've decided for our practice, because our staff don't want to come in. That's it. They've made that very clear.
That's fair enough, Dietz. I think it's a good call in general. I think what we just have to look at is what exactly are the protocols that are being implemented in your practice and in your clinic and all that type of stuff. I know that yours is pretty up to date and on the go. What we've done is that we've actually put a barrier at the door. All right, if you come in the door, the first thing you do is you will wash your hands.
Sanitize your hands.
I don't think sanitizer does it, to be quite honest with you. I've seen too many people sanitize. Jameel, maybe you guys and anybody give us feedback. But I see sanitizer being used as a quick fix. And
absolutely, they don't do it properly. Absolutely.
I don't like the idea of sanitizer. So basically, they have to wash their hands. They have to put a mask on, and they have to put everything that's not in a bag that we supply, right? And then similar to Jameel, as you said, we try and separate them as far as possible, or have as few people coming in. And from there, they go straight into the clinic. And in the clinic, we've set up a whole range of protocols for the staff to follow as well, to make sure that they have the minimum possible exposure. We've got to be as strict as possible. If people don't want to play the game, they stay at home.
Yeah, well, what we've done is there's a form that SADA put out that says, I so-and-so consent to treatment. I realize I am at risk and I'm putting the dentist at risk. And then you have to ask them 5 questions. Well, what we're doing too is we're using a non-touch thermal
thermometer,
screening.
Yeah, absolutely.
That's what we do. So the folk come in. In our case, we've got a disinfection center right there at the door. They have to sanitize their hands. That's what we're doing. And then before we do anything, they fill in this form, and we see that whether they've traveled overseas, etc. There are 5 questions: shortness of breath, etc. And we also thermally screen them with a non-touch device.
There's one thing. This is one thing that I forgot to mention. That this is what the guys out in Singapore, Hong Kong are doing routinely now. Is the non-contact thermometer. So patient comes in, non-contact thermometer, and then not just for them, but the staff are getting done this twice a day as well. So they're doing it in the morning, in the afternoon, and if anybody's exhibiting a higher temperature, they're being sent home.
Absolutely. That's exactly what we've been doing since this whole thing broke. But we're going to keep it going now as a normal routine. A lot of the things that we've instituted now that we may not have had before, like the disinfection station, etc., at the front door. So what they do is when they come in, they disinfect, they fill in the form, they get screened, they sign the form, and we're happy to see them. We see them with the appropriate hygiene measures. And once they leave, the last thing they do is they disinfect their hands, sanitize their hands, and leave the practice. So we've done that.
I think, Dietz, you've got a good point there. I think this has been a wake-up call for us in general in the levels that we have to function with or function at in our clinics. And I agree with you. It's something that's got to stay.
I see major benefits. From our perspective as clinicians, I'm very happy about this all. I just don't like the whole concept. I think there's something very sinister behind the whole pandemic, but that's it. I'm not a conspiracy theorist, but
no, absolutely. I mean, I think we have to look at those type of things as well, and I'm sure more things will come out afterwards. And I hope it's not going to be some sort of like blame game, and then we're into some sort of escalation all around the world, military and things like this. But you never know.
Trump doesn't play blame games ever.
Yeah.
But I must say, Jameel, what I've done is, I tend to be a workaholic, and this is the first time in my entire practicing career that I will have ever smelled 21 days of not being at work, except for emergencies. And I've just decided, I've resigned myself to that fact. I have my kids at home. I have a lovely wife. I live in a comfortable home. I'm just going to enjoy it.
Yeah, well,
And
that's absolutely true. So I'm speaking to Huang in Beijing, and they're just coming out of their lockdown 8 weeks later. And yesterday he was saying this is the first day that we've seen the traffic on the road again, the traffic jams in Beijing. So things are returning back to normal. And what he said was that when I was looking back at the time, I wish I hadn't wasted it. The best thing that I did was to get 1 ton of masks and supply them to the local hospital. And then he said that this time is going to go. You're going to be back to normal again soon. So use it well. So this is coming from people who are right there in the epicenter, of the main thing. And I think we have to learn from each other. And definitely, it's not just a case of. I spoke to another person. I don't know if you guys know Mario Imburgia. He's an amazing dentist based out in Italy. So I sent a message to him last week or the week before. Hi, Mario. How are things going? Thinking about you. He's in Palermo. And he was saying, don't worry, Jameel, we will come out of this stronger. But one thing that I've come out of this is that I've been enjoying my family like never before. So there's definitely going to be good things that come out of it. So just let's try and use it wisely.
Absolutely. Just a thought about chairs. It's not a bad thing to have 2 chairs. And what I used to do when I was on my own, I had 3 chairs. I used to alternate them.
Yes.
And I used to give presentations in infection control. And I used to call it dressing up and dressing down a chair. So you'd use a chair, it would be cleaned, then you'd move to the next surgery. It did mean that you'd have to obviously spend the extra money to equip 3 surgeries, both in terms of materials and equipment. But if you want to really practice good infection control, that's not a bad way of doing it, because you only get back to that first chair, because I work on an hour per appointment as well, I always have. So it means then it's 2 hours before you get back to that other chair. And that gives it a sense. But it's an expensive way of doing it.
Yeah.
But anyway,
Marco,
just thought I'd share that with you.
I was going to ask Marco quickly. Marco is not part of the study group, but he's a friend of ours from Joburg. And I just want to ask him, what's the general feeling of the guys in Joburg? How are you guys operating, and what are they going to do for the 3 weeks? Because I kind of feel like everyone wants to go on as normal. So what do you think is happening up there? Can you hear Marco?
Just quickly.
There we go.
Yeah, sorry, I've got you there. I think the general feeling is pretty much the same. We're all closing practice, and only emergencies, prescription triage, and those sort of things. Yeah, so that is the general consensus. But there is some people that are forging forward and want to work, trying to risk it all. So we'll see. I don't know if that's a good idea. I think the general consensus basically is shut down and wait.
I said we're going to try and keep it under an hour. Is there anything else, anyone else who wants to add something or wants to ask a question? Jameel?
Yeah, I want to ask one question. Evert, how many times did you touch your face tonight?
Yeah,
me all the time. I know.
All the time. It's so difficult, isn't it? It's so difficult. It's unbelievable.
My face is very clean.
Yeah, it's very difficult.
Because that's another point, Jameel, is I've actually advised folk to actually wash, not guys, us. I used to do that, but I got out of the habit. At the end of the day, before I went home, obviously I washed my hands thoroughly, and I used to wash my face. Because the first thing that happened is when I got home, my wife would want to have a kiss. But as we've got older now, I thought, well. So what? She's probably immune to most things anyway. But I just want to say, Evert, thanks for organizing things, and Jameel, thanks for your time.
No, it's a pleasure. It's a real pleasure. And Evert, hopefully,
I've really enjoyed it.
Thank you, Evert. Hopefully, we'll get a chance. Maybe when this is over, we can go back to our original podcast and we can just have a chat about other things in life and things to do with dentistry again.
I hope so.
Clinic
So
and
guys,
dentistry.
just to wrap it up, the consensus is we're all closing our shops. We're only treating patients via the phone. And I want you all to maybe send this message to everyone out there and get the message out so everyone's on board and everyone listens to this and we actually do it, not just say we do it.
And,
but we close
and
our
one last thing, Everett, one last thing. That if you guys can go in and have a look at the Slow Dentistry Global Network website, have a look at it. You know, text or email Nina. Again, she's born in South Africa. That's Miguel's sister. She runs it. And get more information. It really is going to be the thing that sets your clinics apart, I think. So enjoy.
No.
Great
Cool.
fondness,
Thanks
guys,
so much
and
for
peace.
listening, guys.
Take it easy, guys. And thanks again, Everett. I really appreciate it.
Cheers,
Okay,
bye.
all the best. Stay safe, guys. Stay safe.
Thanks, Everett.
Okay,
All the best.